after this presenter, we're going to break for lunch, and then we're going to do one more, our simulation training thing that we're going to do. Why don't you put this on? There's the
The power. Ooh, they give me power. That's dangerous. All right, we got forward, we got backward. I'm going to do Officer Ronaldo's again for you. So
good. Let's do it. Okay. So our next presenter, Mr. Bret Barker, is a seasoned ICU nurse, CCRN, OR and ER nurse, step-down tele and step-down CCU nurse, trauma ICU, medical ICU, basically everything that we could be done.
FMP, DNP as of December 12th.
DNP, MSN, RNC, plenty of stuff here. Let's see. Teaches nursing theory and clinical and associate degree nursing programs since 2008, RN to BSN. Cal State University, what is the MD? Monterey Bay.
Started Gavilan College, now
Monterey
CSU
Bay. Monterey Bay. Mr. Barker began teaching tankers in 1988 in the U.S. Army, men mostly over twice his age, served 12 years as a tank commander. As a tribal member of the Shoalwater Bay Indian tribe Tokelons, is that?
Tokeland, Washington.
Tokeland, Washington. Balanced life was focused on well-being of humanity while maximizing results expected of himself. Multidimensional abilities and personable with a positive outlook to motivate and inspire others who want to achieve. He's done speaking engagements including neuro, cardiac, respiratory, precepting RN students to novice nurses. So help me welcome Bret Barker.
Thank you. It truly is an honor and a privilege to be here. I need to get this up. It truly is an honor and a privilege to be here. And thank you for having me come down here and speak to you. It was a little short drive, about a 3.5 hour. Nursing is not my first career. Portland native kid, kind of made it through high school, barely graduated high school, went to the military, went to Fort Knox, went to tank school, got out, started college, dropped out of college after a semester. Next year tried it again, dropped out of college again, had a couple of families, a couple of divorces. Thought alcohol was a lot more fun with all the other accompanying chemicals that you could find. And so I had a pretty good time up until after 9/11, and everybody got tired of my BS, decided to toss me to the curb, to where I got to wind up living in a beautiful blue building in Venice Beach, right off the Speedway in Washington. It was gorgeous, had a beach view. The only problem is it was a porta potty, and that's where my addiction took me. I like to collect DUIs like some people like to collect Christmas cards and things like that. I have a total of 8, which I have fully cleared out of the system. My record is completely cleared. I have a valid California driver's license. I have a valid California nursing license. And because of all this, the California Board of Registered Nursing has deemed upon me and made me the facilitator for nurse support groups, where I have about 60 different members in probation and intervention for nurses that get into trouble with the Board of Registered Nursing, whether it's through chemical dependency, emotional problems, charting issues. I have pharmacists, I have audiologists, I have dentists, and I have some physicians as well, so I get to give back. I don't know about you, I didn't really have a whole bunch of positive role models in my life. Most of the people that I grew up with were running around on 2 wheels with leather. That's why I have no tattoos. They don't arrest the guy with no tattoos. They go after the guy on the motorcycle that looks like he's a bad guy. But that's just kind of the gist of me. So why EMS first line treatment, probation intervention in your patients in LGBT? I'm going to combine this all together. Part of my giving back, I went back to school at 32. Didn't think I was going to become a nurse. I had too much history. I was in Alcoholics Anonymous meeting, and people were telling me there's no way with your record you will ever be a nurse because of your background. This long-haired biker comes walking up to me and says, you know what, I'm a heroin addict. I did 8 years in the pen. I went back to nursing school, and I'm a registered nurse now. Just go for it, do the best that you can, and kick butt. I still have straight A's. I have 5 degrees in nursing and a 3.83 GPA. That's not bragging rights. That's a miracle. That's hard work and a miracle. Okay? It's definitely hard work and a miracle. Part of my giving back is I volunteer with an organization called Rock Medicine. It was started in 1973 through the Haight-Ashbury Free Clinic in San Francisco, and we put first-line responders at sporting events and concert venues so we can help those patrons that may over-imbibe or having a bad day. Any of you in law enforcement and EMS know that holidays and concerts or stuff are usually amateur night, right? That's when people get in trouble. Guys like me that drank every day, you weren't worried about me too much because I could just pretty much maintain. But it's a guy who just overdid it a little bit and he winds up killing somebody. Thank God I didn't ever do that. I know many, many people have helped a lot of people that have done that, and I can't fathom. And I'm so glad, and that's one reason I fight so hard to get back and give this class wherever I can at nursing schools, not just for nurses, but to come to events like this, to teach you a little bit about what addiction is. In America, we have this belief that addiction is a moral downfall, and it truly is a disease. In 1955, the American Medical Association determined that alcoholism was a disease model being you have to have an organ, which is the midbrain. It has to have an effect on it, which means there's a dopamine imbalance in it that affects your behavior. So I'm going to get into just a little bit of your drug use and how those things happen. Most people want to, hey, you want to have a beer, smoke a joint, do a little line of cocaine, that's your experimental. Start hanging out with your buddies that are doing the same thing. That's more that social, recreational type of substance use. It might become a circumstantial situation. Has anybody ever said, I've had a long day, I need to go get a drink? Anybody? Nobody? Okay, good. We got some honest people in here. That's circumstantial situational, right? Nothing wrong with it. It's all self-medicating. We just want to call it what it is, okay? And that gets into intensified. Okay, this is when you get home and you get in the tub with your book and your glass of wine and nobody's home, and you got the whole bottle of wine with you, and you need that to help you unwind because you're not having other healthy coping mechanisms to get through your day. And then it becomes compulsive. It gets to a certain point where there's a switch, especially on the alcoholic, where the thermostat is broke, we don't have a negative feedback mechanism, and more is just never enough to get us to the point that we need to be. So it becomes a compulsive. And by compulsion, if you want to think about addiction, when people say the obsession of the mind was lifted when they're free from alcoholism, what that means is they're not thinking about getting loaded, and they're not thinking about not getting loaded. That whole thought of it can finally go away when people get into recovery. So addiction is a moral problem, not a disease. Locking people up or putting them in asylum is the best. Is that the truth? Is that a true statement? Lock them up. 3.4 million people incarcerated in the United States for drug-related problems or drug-related issues related to their drug use, whether killing people, robbing, burglary, whatever they need to do to get their drugs. 1973, the Scheduled Drug Act came out. So all the happy stuff that you got in Dr. John's snake oil, like cocaine, morphine, heroin, marijuana, whatever else they wanted to put in that stuff, wadding them on the other goodies, became illegal according to Mr. Nixon. So the president made that illegal, so poof, they had to go away. Do you think that all of a sudden Americans said, oh, we won't do that anymore? Didn't happen. So it became illegal. So we had a lot of problems happen with that. After that Scheduled Drug Act, we got the DA. We've been fighting this for many, many years. And it comes down to it not being a moral issue. We can use drugs for good. Who thinks drugs are bad? Anybody? One. All drugs do exactly what they're supposed to do. The outcome may not be so good. Somebody tripping out on LSD too much and biting the windshield out is probably not so good, but it did exactly what the drug was intended to do. I'm in the operating room, I give somebody some fentanyl and some Versed so they can calm down before I cut a hole in them. It's probably a good thing I did that, because smacking them in the head with a hammer is probably not cool. And the fentanyl and Versed will wear off. And I'm giving it in a controlled environment, and I'm not giving a whole bunch, and they're not getting high. So drugs do exactly what they do. What we're going to talk about more is drugs of addiction and how that triggers the dopamine in the brain and why it becomes a problem. I threw some of these up here for this lecture because I wanted to entertain your mind to get you thinking about this before I start talking about the boring stuff and chemical dependency and addiction and brain chemistry and things. So Americans in general do not like the way we feel, so we want to change the way we feel with mood-altering substances. Who knows what the first cash crop in the United States was? Roanoke, Virginia, they grew what?
Tobacco.
Tobacco. Was it corn? Was it cotton? Right? They weren't making Bibles. They were growing tobacco, a drug, a stimulant. Okay, so that's exactly what they started doing. We've had more cash crops. What were they doing in the Caribbean? Growing sugarcane. What were they making out of sugarcane? Rum. Right? They were making pies. They weren't sending it to France to make pastries. They were making rum. So historically, Americans have had some type of addictive behavior. If you look around now and you look at half of the country with hypertension, half of the country being overweight, and about 30% of those overweight with type 2 diabetes, I would think there's some food addiction issues in the United States as well. So we're just kind of wired that way. It's not a bad thing. We just need to understand it so we can deal with it. All right, health providers are the most judgmental and jaded caregivers in the population. Do you view yourself as that? Who's taking care of a drunk? Who's taking care of an addict? Who's had a positive experience taking care of a drunk? Who believes me when I say that trying to negotiate with somebody that's intoxicated is trying to eat lukewarm Jell-O with chopsticks? Okay. You can do it. It's the approach. The anger and the aggressiveness, I found, doesn't work. I find in RockMed, I carry puke buckets. I have people puking in buckets all the time. I talk to them, I calm them down, they puke on me, give them a little Ativan. Some guys are a little heavier, I give them a 50-250. That's 5 of Haldol, 2 of Ativan, and 50 of Benadryl. Usually they kind of go night-night, then I can ship them out to EMS, and they can go out to the hospital. Because in rock medicine, our whole idea is to help get the patrons sobered up, get them back to their families, and avoid having to go to the hospital or having an encounter with law enforcement. Doesn't always happen. Sometimes people get really belligerent, and it's like, officer, come over, help me out. They're not playing with us. But for the most part, somebody that goes to a concert and has one too many tequila sunrises shouldn't have to spend 50 grand, lose their job, get a DUI, blah, 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 blah. Especially if there's somebody else. So that's what we do. What do you think? Do you think drug and alcohol treatment works? Yes or no?
Yes.
How much? Do they have to be ready?
Yes.
You sure? Bring the body, the mind will follow. Bring the body, the mind will follow. I know for me, I was a polysubstance abuser my entire life. I had my first sip of beer when I was about 2 years old on a house called in Trinity County. Went to Olympia, Washington when we were living in Anderson. When you go to Olympia to visit family, you got to go to the brewery. Got back home to Anderson. I took all my Tonka toys and electrical tape, and I was building a brewery. I was 4. I remember my very first blackout drunk. My dad's 3rd wedding, they had a champagne fountain. I got completely hammered. I was 12. So I've had a little bit of experience. Dad grew up in Hawaii when I was a kid. When I was like 8 or 9, gave me something to do when I was in high school, make a couple extra bucks. But so, environment, people that were around, finding good role models. Sometimes it's not easy. Growing up in a little house up in Hollister, I mean, it's a small population. So you get with who you get with. And and it's nice when you can get clergy, you can get people to guide you along the way. But it doesn't always happen. I was an acolyte, and I put a bottle of wine up under my skirt, and I walked out to the car like this to slide it underneath the third seat of the station wagon so I could take it home. Sobriety, for me to stand here and talk to you like this, is against my normal nature. Believe that. July 12th, as I was driving down here, I swung by the Greenfield Police Station and took a picture. July 12th, 2002, the last time I gave him my brother's name, and they didn't believe me because I'm taller than him. This one last time when they arrested me, they took me to Monterey County Jail. So now we're going to get into nursing. Let's get into nursing. I'm going to skip the scheduled drug acts, and we're going to talk about some chemical activities in the brain. After I tell you this quick story, there's a long list, and you're going to hear me talk about a few of them. Reasons why I became a nurse. I was in the military. I was in aerospace. I was in the aftermarket Harley-Davidson business. I have been completely successful with every single thing I have ever done in my life, including screwing it up completely every time. Relationships, education, all of it. So I'm a pro. But the one thing is I wanted to change that. So after a couple of DUIs, and they caught me and they threw me in jail, and I got to spend 97 days in Camp Elmwood up in Milpitas, I had enough time. I had spent enough time in and out of Alcoholics Anonymous and Narcotics Anonymous to get a head full of information. But I didn't have enough time away from people, places, and things and drugs to let that sink in. So when I got out, one of my top of my list is I wanted to be a nurse. And there's a lot of reasons for that. I'll tell you my first one. When they arrested me in Greenfield and took me to Monterey County Jail, where's my nurses in here? Where's my stroke nurses? CCRNs like myself. Blood pressure, 246 over 120. Guess what the nurse told me? I can't do anything for you. That's number one. Can't beat them, join them. That was number one. Because they don't understand this stuff. I'm going to get into this stuff. Up here is our good old brain. Anybody know what the chemical of addiction is? Dopamine. The feel-good, pleasure-reward circuit. Anything that releases dopamine, whether it's sugar, nicotine, caffeine, cocaine, methamphetamine, sex, whatever it is, triggers a dopamine release in your brain. It can be anger. It can be driving fast. It can be jumping out of an airplane. It triggers a dopamine release in your brain in the ventral tegmental area down here in the midbrain. Okay. That sends a signal through the nucleus accumbens up to the prefrontal cortex where you have that rational thinking. So that's when I get into, okay, is the addict making a choice, or is it an organic disease process where he really doesn't have a power of choice? The choice to take the first drink may exist, but once that first drink of drug goes in, they're now impaired. Does that make sense? Because you have a feedback mechanism from the prefrontal cortex where glutamine sends it back and says, that was good, do it again. It's the pleasure-reward circuit. Men and women would not mate and reproduce on this planet if it didn't feel good. Period. So if you're not getting that dopamine release and the glutamine feedback through your brain, like, that wasn't very good, guess what? You're sleeping in separate beds, you're doing the I Love Lucy thing, and you ain't having a kid. So that's just the nitty-gritty. So people use alcohol to relieve stress. We use all kinds of things to relieve stress. We run, we jog, we jump out of airplanes, we shoot weapons, some people chase women, some people shop, gamble. Sometimes people use some type of substance. It could be food, it could be cocaine, it could be whatever. I mean, I love a good cookie. You know, had a band, Ben & Jerry's, because I went on the keto diet, but I like the Halo Top. It's cool. I love it. It's delicious. But with stress and alcoholism, originally, it's pretty benign, typically. I mean, I've yet to see somebody skipping along the street, I'm going to go become a dope fiend, right? Have you met anybody like that? Like people coming into OR, in the ER, I heard. You just skipping along the street and just thought you'd come get admitted for 3 days. A lot of times, I mean, there might be a small percentage of those. We got in our little black book that we know we're the frequent flyers. But for the most part, they're not coming in here to just come hang out. I just had a heart surgery 2 weeks ago. I didn't want to go, but I needed to get my heart fixed. So I had to go, I had to tolerate it, and I had to deal with it. So I did. But it still wasn't very much fun. All right, so at first, when you first have that first drink, who remembers their first drink? Anybody who drinks in here? Okay, take a drink. Right? That's what they sell on the commercials. You know, drinking the Bud Light. Right? That's what they're selling you. They're selling you that relaxation. Second and third drink tastes like garbage to me. Right? But first one. The first one is awesome. You can return to normal function after that first drink. People that leave a half a glass of wine on the table, that's alcohol abuse. What are you doing? But they can do it because they had their share. They had their share. They're like, I'm done. And they're good. Okay? Their body remains to normal function. I'm going to just say addict because alcohol is a drug. Okay? And addicts are addicted to drugs. Alcohol is a drug. So I don't separate alcohol and alcoholic. Addicts, period. After repeated exposure, your body gets used to a certain amount. You start building more cytochrome P450 in your liver to detoxify alcohol. There's genetic components where people are more susceptible to process alcohol quicker, so they can drink more. And then there's some populations that one drink and they're passed out on the table. I'm not one of those guys. I used to think it was a bragging right when I was 13 and I could just keep tapping the cake. Man, you sure can drink a lot. Well, thanks, man. It was not a bragging right. It was not a compliment. I didn't know until I was like 30-something. Who knows? So changes in the brain occur. Okay? We not only build tolerance with our liver, we build tolerance in our brain. We put stuff in your brain that says, hey, this feels good. Your brain says, let's make some more receptors for that stuff. We like that. We want room to get whatever's coming in. The problem is, when that starts to wear down, those start to shrivel up and they cause you pain. Who's taking care of an alcoholic seizure? Who knows why they have alcoholic seizures? Benzo or alcohol. Those are the two that'll kill you. All the other stuff, you feel like you're going to die, but alcohol and benzos will kill you. You know why?
Withdrawal, not getting it?
Why?
Because they've been a few days without it and they're used to it.
Cool. I'm going to give you the nitty gritty.
All right.
Brain waves. You get drunk. Brain waves go down. Your brain says, you need to wake up, bro. Starts making stimulatory excited neurotransmitters, right? You're like, I'm a drunk. I don't want to be up. So you start drinking. You start suppressing it. Your brain says, you need to be awake. You got to breathe. You got to eat. So excitatory neurotransmitters bring your brain waves back up. You're like, this isn't cool. So you have a couple more drinks. Then you bring it down. Suddenly take that away. You have all these excitatory neurotransmitters running around and your brain is on fire and the lightning storm is going on and you start having seizures and you die. Been there, done that. It sucked. It wasn't in the hospital. Horrible. Horrible. So I take care of a lot of detoxing patients, whether it's alcohol or drugs. Fellow nurses I work with in the unit, they give them to me because I know how to treat them. Not that I'm coddling them, I'm not parading them, but I get the physiology and the neurochemistry of it so that I can help get it past that part and I can start having a talk. Because if a guy like me can get sober, I think there's a large percentage of people that can get sober and stop hurting people and their families and things. We'll talk about the family disease some other time, but let's just keep cruising. So the spiral of dependence grows as alcohol actually creates more stress. Okay, I got to the point where I was drinking a 500 ml bottle of Jack Daniels. That's a 20-second shot every 2 hours, all day long. I had to hold it like this to open it so I could put it with both hands to my face so I could shave to drive to work at 7 a.m. I was a danger to the public, yes. So yes, I have DUIs. I applied for thousands and I think my lucky stars and I try to give back. I can never repay, but I do try to do the best that I can, and part of that is with education. Just was working with an 18-year-old the other day who killed and hit somebody, and she's trying to deal with all that. Killed her 16-year-old best friend up in Carmel. And yeah, it's heavy stuff. So it affects everybody. The perps, the victims, everybody is involved. And it's a very sad thing, and we don't know enough about it to actually do something. So theories of addiction. So here's that dopamine release. So here's some numbers. Just call them units, just to give you a gist of things. Eat food. You're going to have food. You're going to get a little satiety. 150 units. You're like, right? After that, you might have some sex. That might give you a little bump. About 200 units of dopamine. Nicotine, the after sex cigarette, about 225. Get yourself a little morphine, is about 200. Cocaine's a little higher, about 350. Methamphetamine is a ton of dopamine release. It's insane. It's about 1,000 units. About 1,000 units of dopamine release. So now I'm going to give you a pop quiz. 3 routes of ingestion. Smoking, IV, or taking a pill. Which is worse? Who says IV? A few. Who says a pill?
I take a pill.
Who says smoking?
What are all
It's about even. Smoking, anything goes into a huge vascular bed. It's the worst, fastest way to get a drug to your brain ever. Take a pill, it goes to your stomach, you digest, goes to your liver, you shoot up, it dilutes in your bloodstream, it eventually gets to your brain. But cigarettes, why are they so addictive? Because it goes right in this huge vascular bed. It's just instant. So whether it's crack, meth, cigarettes, marijuana, it's going to go right there. So just like, I just saw a video the other day and somebody said it was IV, and I'm like, oh, are you kidding me? It's like, trust me, I've tried all this stuff, smoking. And I've done the research. Yeah, no kidding. The last 3.5 years I spent on. I haven't had 12 years of nursing school as of December 12th. That's insane. You know I'm insane. 12 years of primary school, 12 years in the Army, and then 12 years of nursing school? I'm insane. Okay, so potential for abuse by types. What do we got? 5 minutes. We're going to kick up. All right. I want to talk about something more fun. You. I want to talk about you. I want to talk about you, and I want you to think about you, and I want to think about you and how you take care of your patients. Okay, I'm not saying you're going to call to your patients, but if you see a patient in a car and they're flipping out and they're kicking the door and stuff, they might have hypoxia, they might be on drugs, they might need their drugs, they might be hypotensive, there might be some type of medical thing going on. So please don't just start tasing the patients right out of the gate. Protect yourself, but there might be a medical situation going on with that. Factors in all of you that are going to put you at a higher risk for addiction yourself, whether it's a chemical, relationship, gambling, shopping, or whatever other little vice you might want to find comes from. You're expected to be the caretaker. You're working abnormal working hours and shifts. You sacrifice family time. I got to go to work. I'm on call. Right? Who doesn't do that? Y'all do that. You can email me this too, and I'll send you the hard physical work. We do difficult mental work. We have some element of being in control because we are some type of authority figure. Right? And for me in the ICU, I got 12 drips, I got dialysis, I've got fentanyl, Versed, insulin, dopamine, levophed. I've got all this stuff. I'm taking carbon charge for this person's life. Give them some Lazarus syndrome. By the next day, they start perking up. It's a trip. It's a power trip. So be very careful with that. You get little emotional support. Who in your home, unless they do what you do, can even understand your daily life? So as Dr. Rinaldi, or Officer Rinaldi was saying, get somebody in your cohort, whether it's nursing school or wherever. I suggest not somebody at work, because things can happen with that. But somebody in your cohort, different precinct, different hospital, different nursing school that you can confide in. That's why I have people come to their support groups. Because you get very little emotional support. You're doing what you're supposed to be doing. And it's an expectation that we never get to take care of ourselves because we get the Superman syndrome, which will kill us. High stress levels, need for constant updating of skills. We're always doing some kind of skill updating, right? If you're not, then I don't know how you're doing that, but I know I'm constantly doing skills updating. You get a lack of recognition. You work with very difficult patients. We have an easy accessibility to drugs for those of you in EMS and in the nursing. And we have some acceptance on some level to self-medicate. Oh yeah, go have a hot toddy, and I'll see you at the work in the morning. Oh, don't worry about it if you smell like whiskey when you come in. Just take a couple of minutes and we'll send you on the rig. Okay. The factors that increase any health professional with addiction is we're the type of person to put other people's needs first. These sound like positive things, right? Well, they are. But we have to balance them. We use denial in the work setting. You think I can walk into somebody and stick a garden hose in between a couple of their ribs and listen screaming in pain, but I know it's going to help them breathe? I have to have some denial of my humanity to be able to stick that in there. 18% of healthcare professionals are heavy drinkers, just using alcohol to deal with job stress. And then it gets worse with all the different varieties of prescription drugs and other things that we can find. Many health professionals and people in the caregiving professions come from an alcoholic or a codependent or domestic violence background. So we're trained as children to become caregivers. Who knew that? Man, you do now. Adult children of alcoholics and different things may help, and the spouse is commonly alcoholic. Factors, employed women in general have a higher rate of alcoholism. Nurses, EMS, police, we are providers of care, not receivers of care. We're often giving advice to people, telling people what to do. We're not having people tell, hey, you know what? Oh, I know what to do. I'll take care of it. We need to let other people do their job. When I'm the patient, and this has been hard for me, I need to be the patient. It's hard. Anybody have that challenge, being a patient? You're the caregiver and you're like, this is wrong, this is just be the patient. It's really hard. I'm the type of person who's a perfectionist. What we do can kill people or keep them alive. So we're perfectionists. But we also have to remain that we're human. We have to know what our limitations are. Ask for help if we have some weakness. Hey, you're good at that. Here, can you come help me? I'm going to go do this. And you draw in somebody else to help you out. And then believe that pharmacology will lend you some sort of protection. Like 2 drinks, I'm cool. 3, I'm probably over the top. So those are the type of things we're talking about. I'm going to skip through addicted caregivers and surveys. But barriers to help is the big one, and this is going to probably help you the most. Health professions as a whole are very judgmental. We are trained to not judge our patients, but among each other, that's not true. We are the most judgmental people among each other. I hung that IV for you that was running dry. Well, yeah, it was running dry. I knew it was running. You can't explain it, but they're very judgmental. We have an idea that we can fix the problem with knowledge. knowledge just does not fix the problem. It's teamwork, it's effort, it's discussing these types of things and having crucial conversations about how we can get a solution. Fear of problems with the license. Majority of nurses I get that come into probation and interventions are so afraid of their license, they use in secret, they drink in secret, they steal drugs from work, they get high, they get so high until they wind up in the hospital or they get a DUI and arrested and we find out they've been diverting drugs by the time, and they're so sick because they're afraid of losing their license. When if they preempt it, they'll protect their license up front. Going into intervention, they do a 3-year program, their license is clear at the end, and they got treatment and they're clean and sober. But we set them up. That's a total setup. Acknowledging the problem is admitting a loss of control. Who wants to say, I got a problem? I got a problem with my heart, I got a problem with my hips, I got a problem with my knees, my kidneys reject. They fixed my heart, I got stabbed in the neck 3 times on each side on Tuesday. I can admit my problems. I got some other problems I'm not going to tell you about in this company, but for the most part, I'm pretty good with it. But it took a long time. You know, I want to be Superman. I carry a Superman ring on my keychain to remind me I'm not, because I get that mentality, being the Mad Max, being the tough guy, being all that stuff, being able to lift huge amounts of weights. We feel like we're that. Got to find a buddy. Got to keep grounded. You can still be a tough guy, but you got to be grounded. And then the lack of optimism about treatment, not just by nursing management, but the public in general. We all had people that have family members who are injured by drunk drivers. We have family members who are married to alcoholics. We have family members that survive either our own personal experience or domestic violence and different things. And the thing is, we see nurses disappear. They get in trouble in hospitals. And so the nurse managers don't see those that get into recovery because they never come back to that hospital. They go work somewhere else. So for those of you in recovery, not that you have to shout it from the rooftops, but please let people know that it does work. Because it really does work. Am I out of time? All right. I'm going to throw some numbers up here. I'll send this PowerPoint to any of you that want it. So the Maximus is a contractor with the Board of Registered Nursing. They do the intervention program. Beer and diversion program manager. You can call the probation monitor up there. You can always call me. There's my number. So we're good.